lesson learned from other countries, actually, because you can't do it alone. And you can't just do it reading paper or scientific papers. You have to engage. You have to listen to the actual stories. Each country has its own strength and experience. Even in our country, we have stories that we want to share. So that's why we engage. And, we don't need to start from the beginning, from the scratch, because there are a lot of opportunity and organizations and companies, private, whether public, even governments, they are innovative in their solutions. And we want it to be adaptable. We want to integrate all that for our benefits. And we could share our stories with them so they could work with that. And one of the solutions we mentioned, and maybe it has been mentioned many times in the harmonization of credentialing, because it's painful. We have been there, and we see the value of having a harmonized credential for all.
I mean, share that with us a little bit. What kind of, what's your experience of seeing how, how you credential workers coming in from international markets? What examples have you seen and have you learned from in other markets about how the way that they do it?
Well, the first thing is maybe recent one. So I will not be shy saying this. The Commission in a couple of years back, when it comes to standard registration and classification, we had like one size fits all. Whether you are a cardiac surgeon or you are a technician, same standard. And we claim that's for the good of the public, for public safety, for patient safety. However, moving forward, we thought and we discovered that we are, making the market dry. So supply and demand are not equal, because we thought as a policy of caring about safety by putting a standard that fits all. Actually, what happened after going afterward and learning from other experience, in one event we attended, and there was Sir Harry, he is one of the experts on professional standards. So he has a concept of a standardization based on risk. So we had to adopt this concept. It's right touch regulation. So we regulate upon the risk about each individual. So you can't put a cardiac surgeon on the same, criteria when you are regulating or actually registering or classifying or recognizing, let's say, pharmacy technician or nurse technician. They vary. So we adopt these concepts from others. Another example is, I was in a visit to Indonesia. And we had a lot of dialogue about nursing and their capability, and they have a huge supply, actually. So we partner with them, we shared with them what's actually the competencies. And the session before, I don't remember who said that, competencies of nurses is unified all over the world. Yeah. So, however, we find a way that they have some obstacle with the language, some obstacles with, experience we have been for work. So we started with them now some exchange program for, sending their students here or sending our doctor or physicians there to actually build and collaborate just for the sake of, the mobilization of health workforce.
Yeah, those exchange programs are fantastic from the point of view of, we talked, I think, equally, I can't remember which of the panel it was that said it, but it was a great point about, there are core competencies and then there are the individual contextual competencies that come alongside those. And I think, the two things have got to be put together. The ability to exchange workforce, to give people experience of a different patient cohort, maybe different levels of technology, different ways of doing things are hugely important. So, yeah, applaud you for that. I think we need to do more of that, don't we? We really do. I guess the second point that goes with that, what have you learned? I think there's always learning and teaching. What do you think that you have achieved as an organisation and as a country in terms of your credentialing and your ability to develop your workforce that you could bring to other health economies? I mean, I'm kind of going to answer, it's the digital piece, isn't it? It's that ability to do this with technology. Is that right?
Again, the Saudi Commission, it's unique in its governance. It gives us an advantage that one entity regulate and standardize all health professions. That was, a strength we noticed during COVID. So it was easy to mobilize and be part of the system on actually knowing where are those healthcare practitioners spread around the kingdom, because they are under one umbrella. Even when spreading courses, so how we were fast in disseminating our development courses to deal with COVID and the circumstances there. So it was one shot because we've invested in the data. I know data sometimes or in some areas it's difficult. For us it was difficult in the beginning. We have to do a lot of work until we reach points now that helps us, and we have a platform called Mumaris Plus. Mumaris Plus, it's in Arabic, it's Practitioner Plus in English. So this platforms, and I invite you all, if anyone is interested, is to talk to us, because we are really open to share this experience of the platform. And actually, we invested a huge amount of time and money and resources in building that. So it could be easy to have workforce alignment, disseminate courses development, actually knowing where are those practitioners spread in the kingdom. So investing in digital, being innovative in your investments, where to put your money and resources would be beneficial when it comes to workforce planning.
What do you think from the point of view of the actual practitioner? You've got somebody who wants to come to Saudi, who is, or to the US or to the UK, wherever it may be, who wants to go and practice in another country. What do you see what do they see, crucially, as the barriers to being able to actually mobilize in that way? And how are you trying to help solve those problems?
Well, first thing, they don't know. So if I want to work in the US or Canada or anywhere in the world, reaching to the information is difficult, because it varies. Each country or each system has their own, way of doing things. Here in the US, it's on the state level. In Saudi, it's on the country level. In other countries, it's different, it's scattered. So accessibility to data and guideline is something, difficult. This is number one. Actually, one more thing is when it comes to, I would say, the recognition. So if you are a nurse graduated from any country, how could we, recognize your, it's different, it varies, and there are no standards anyone could follow. So this is another, painful experience that international face. We don't actually see more of that now because of the outreach we try to do. We engage with people, actually. We do visits to country. We work with embassies to actually facilitate this kind of awareness session on how can we move forward. We educate each country, depends on their regulation. We actually do study qualifications of each country, so actually we could publicize data that's accessible and people could use it.
I suppose there's a piece there about actually marketing and socialization of the kingdom as a destination for workers. I mean, my experience has been, one, kind of personal recommendation, I love working with these guys. They're a fantastic organisation. I think over the course of the last year and a half, we've all become friends. I feel like an honorary Saudi sometimes. How well understood do you think Saudi is as a destination for healthcare workers? Are enough of those individuals that are qualifying, that are thinking about where they want to take their careers. And the reason I asked this is because there was a point in the previous panel where one of my panelists, I can't remember which one, said the ultimate aim for most of these healthcare workers is to come to the US. Yeah? Shouldn't they be coming to Saudi?
Yes, why not? We have a great infrastructure, actually. We have expanded our seats in training. So in 2021, we have only 4,000 training seats for physician for the Saudi board program. Today, next month, 9,000 will start. So we expanded. We have a great infrastructure, great hospitals, great education system. And now we have a specific track for international students to apply and join the program. So this is kind of thing. I invite you all to experience it. And Saudi now is a destination for sport, for tourism, sightseeing, the weather, everything is good.
Maybe not the weather in August, it's a little hot.
It depends. We like it hot there. But really, actually, I invite you to explore the opportunity because we believe Saudi Arabia is a great destination for health development program.
And it is, I think, still sometimes misunderstood, but it is the friendliest, most welcoming people, country that I've been to, and developing at such an incredible rate of knots. You know, the World Cup, you've got Neom being developed, you've got the Red Sea. I mean, if anybody can get me a room at Al Ula, some of those, the Cave Hotel looks amazing. Yeah, it is that. There's always an element of personal to this, isn't it? We're talking about human beings that want to come and work in a supportive, rewarding environment. Is that another key attraction for the kingdom from your point of view?
That's one. And the great infrastructure that we have is one. The supportive program that we do in the Commission when it comes to healthcare, we have great investments in well-being and mental health for physicians. We have a specific program called DAIM, or supportive, that's catered and designed for healthcare practitioners who work in the kingdom. Plus, the job availability, the training we provide, And again, more than 40% of our healthcare practitioners are non-Saudi. So we don't need to elaborate more on that. So they are experiencing it. And a lot of them, after they finish with Saudi, they go to other markets. And that's the thing.
Take their experience home with them. Take the knowledge that they've gained from working in an advanced health system with great technology, great facilities, back to their home markets. It's that thing about a diaspora being able to take its knowledge and experience home. There is another key point to this, though, because on the one hand, it's great to attract the best talent from around the world, people to come and live and work and practice in the kingdom, but we have to do it ethically. And this is another thing that came up in that last panel, wasn't it? The question that sort of I felt like was being asked there was, I think it was Howard that asked, what is ethical migration? From your point of view, what is ethical migration? How does the kingdom look upon its responsibility as a global citizen to ensure that it's not taking advantage of the international marketplace, but is enhancing it?
Well, actually, if you look into migration, it has benefits and pitfalls, like anything. So we could look at it as the economic impact. Economic impacts for actually those who work in Saudi, let's say, they will have salaries and transfer it to their country. So we are providing jobs on that. So that's one of the benefits. So it's not like that at all. I understand his point of view, and I agree with him when it comes, 80% of the workforce wants to come to the US or, Europe. We don't want to be there. We want it to be facilitators. We wanted to educate those practitioners to actually solve global issues. We have a mission to, promote healthy and globally competitive practitioners. So there is upside and down. It depends from where you want to look at it. But however, ethical migration, when it comes with the great investments of those individuals who comes and sit and work, and accelerating their progress and their career, That would be great things to do.
And I think that there was a really good point made about being prepared to invest in these countries, to be prepared to invest in helping them to grow their working population, to help them to.
Yeah, and another argument of that is like we have countries that they are aging.
Yeah.
How could you solve this issue if you don't have migration?
Mm-hmm.
This is a question on the table. So migration has to be in place to actually serve those countries.
And it does also circle around a little bit to that harmonisation of credentialing point, doesn't it? Because at the end of the day, if you have those core competencies that are common between all health systems, then you've got a situation where a worker can come, learn, practice in Saudi Arabia, and has the knowledge that they're gaining the skills and gaining the knowledge that is going to be acceptable in their own country, in the right way of working, the right way of doing things. I think that's probably really important. I mean, you were at the World Health Assembly with us, weren't you, back in April, when we had some fantastic conversations with Jim Campbell about exactly some of these points. How do you see the Commission's role in that kind of global health economy? Because you are a really unique organisation. I don't think there's any other organisation in the world that does what you do. How do you think we can help to kind of take that agenda forward?
Well, the first thing is we have this experience, we are sharing it with the world right now. So dealing with multiple health professionals from different backgrounds gave us a sense on actually how to do harmonization. So this is one of the things. That's why we participate. That's why we are, in the part of call to action, as Jim Campbell mentioned this morning, and even in, was it May or April?
I can't remember now.
Yeah, it was good weather at Geneva, so I enjoyed it. Though. So those kind of things and engagement, and doing coalition and partnership, on that actually will help us reach to the harmonization, because it's really accelerates healthcare delivery, and it's provide the global security when it comes to health workforce.
We've only got a couple of minutes left, Ahmed. What's next for you? What's next for the Commission? What are the big things that you're working on for the next year or two?
Well, great question again. However,
which again translates as difficult question.
More expansion beyond borders.
Mm-hmm.
I believe health beyond borders is something we believe in. It's in our mission and it's in our strategy. And we wanted to do that because we believe in the good cause of health, because when it comes to health, no barriers and no boundaries should be there. So we believe in that. Again, as I mentioned, we are investing heavily in technology, AI. We have a lot of models that we are adopting that help us predict workforce planning, workforce development. So that's things we are actually investing in.
And developing the data and developing the tools and developing the technologies. I know you've got a whole bunch more of this stuff in the pipeline, haven't you? I mean, is it? Do you envisage a situation where you can kind of get paper out of the equation completely? I mean, how do you? Give me a great example.
I get your. For the sake of time, I'll answer the question.
Go on.
So before implementing technology, for when it comes to registration, so if you apply and you want to get registered in Saudi, and your certification is already being recognized, it takes up to 5 working days. 5 working days. Today, only 30 seconds, it gets approved. Can you imagine the improvement and the paperwork we get rid of? So this is something magical. So those kind of experience we want to share because we have done it. We have done it the hard way, but we reached there. So we were able to do that. So I think this is answer your question directly.
No, absolutely. I think it's just another great example of the way in which some of these more mature, older health economies, my own health economy in the UK, that here in the US, the agility, the ability to invest and the ability to do something completely new. having experienced over the last sort of 5 or 6 years the pace of change in Saudi Arabia, the transformation program going on, which you are a part of. You've got everything that's going on with the clusters and the Health Holding Company and the Vision Realisation Office. It really is a hugely exciting time in Saudi Arabia, isn't it?
Yes, I invite you all to explore it. And again, I extend the invitation for you to join the Global Health exhibition. It will be held in Riyadh on the 27th of October. So please feel free, consider it home. And thank you for attending here. We really appreciate it and feel like home. So,
should we do this again at Global Health? Should we have this conversation again at Global Health?
For me, I think I'm had enough today. So.
Which I think is Ahmed's way of saying he doesn't like my line of questioning. But there you go. Ahmed, it's been an absolute pleasure, as always, my friend. Please, thank you to Ahmed. And thank you to all of you. I'll see you later.